Good evening, everyone. Welcome to Dental CE Academy. We'll be starting here, it looks like, in about 4 minutes. I do want to make sure that you have everything you need. If you go into the chat area, you're going to see some handouts. We're also putting the handout in the banner at the top of the screen. And be sure that you have that. If you check your email, it was sent out about an hour ago. So be sure that you access that handout because it will also give you information on how to get CE credits as well. So at the top of the screen, there's a red banner, and you can tap on that and access those handout and CE credit instructions. If anyone needs a little help, let us know. Be sure to type in the chat area and say hello. I know this is a very large class this evening. It's great to know where y'all coming in from. And again, be sure that you have the handout and CE credit instructions by tapping on the red banner at the top of the screen, or check your email, or you'll see it in the chat area as well. Lisa, just put in your last name for us in the license number. That's fine. All right, we'll be starting here in just 1 minute. So be sure that you have the handout. If you need help, let us know. There's another 100 of you that just jumped on here. So please be sure to tap on that red banner at the top of the screen and access your handout and CE credits. Yeah, you'll get the passcode at the end. I will explain that to you. Not a problem. So I think we have someone, at least one from every state here in the US and beyond. So welcome, everybody. We'll be starting here in just a minute. All right, I'm going to go ahead and review the housekeeping with you. I'm Dr. Rowling. I'm the Chief Education Officer here at Dental CE Academy. Welcome to you all that have spent some time here registering and jumping on our class. We appreciate seeing you here this evening. This is Unlocking the Hidden Wealth of Your Practice, 4 Keys to Success. Now, to receive CE credit, the quiz is available right now, actually, and it's in your handout. But if you go to our website, we'll put the link here in the chat area. You'll see the quiz navigation at the upper part of the screen. At the end of the presentation, I will be offering a passcode to all of you that you'll need to enter to verify your attendance this evening. And then following our presentation, you'll have the opportunity to hear from Curve Dental. And we invite you to stay on. So please be sure that you keep your questions all ready for us, go ahead and type them into the chat area as they come to you. And Cassie is going to be sure to revisit those at the end here. All right, so this is unlocking the hidden wealth of your dental practice again, and this is 4 keys to success. And again, if you have any questions this evening, let us know by typing into the chat area. And I'd like to introduce Cassie to you all. Cassie Tallon is the CEO of the Fractional Match. She's speaking on behalf of Curve Dental this evening. She's an expert integrator and renowned operational leader in healthcare with over 20 years of industry experience in marketing and operations. She specializes in optimizing internal workflows for dental service organizations and achieves operational synergy through strategic integrations and partnership management. As a practice manager at Branson Dental Center, she oversaw 30 plus employees. She drove a 189% production growth, leading to a highly profitable acquisition. Cassie is a renowned speaker on strategic operational efficiencies in the dental industry. She has a profound understanding of operational marketing dynamics, and her ability to drive growth through strategic integrations and her expertise in marketing make her a highly sought after leader in the dental industry. I have to preface that by saying I've had conversations with Cassie, and she's brilliant. You can't get a better speaker on this topic, really. So Cassie, thanks so much for being here this evening. We'll be here in the background to address any questions.
So much. Thank you so much. Well, hi, everybody. I'm from Dallas, Texas. I'm coming to you from Dallas. So for anybody in the Texas area, you're probably ready for some cooler temperatures as much as I am. I'm excited to be with you tonight. And this topic is near and dear to my heart, specifically because I just believe in the power of smooth operations in a clinic and what that does to transform things. Tonight, you may hear a few things that seem redundant because you already do them, but my goal and hope is that you'll pick up on a few gold nuggets of things that you maybe haven't considered before. Just quickly about myself. I have been in this industry a very long time and have done everything from, front desk to office manager to practice acquisition and going through that practice acquisition with a team. And so it's just been a wonderful journey in dental. So I'm excited to present to you things that truly are not just ideas I've developed, but things I've learned from being in the dental clinics and just how to work better with teams and what we can do for operational success. As mentioned, I am sponsored by Curve tonight. So you may hear a few times where I share Curve Dental as my PMS solution, my go-to solution. And it's all kind of this integrated process that I truly do believe in because I've seen it work firsthand. So I want to just challenge you with this idea. Again, you're going to hear a lot of different thoughts and processes, but sometimes it's good to take a quick step back and do a reevaluation of your customer care and how you're driving revenue in the clinic. And so what if you're just one key away from unlocking that revenue in your practice and what it needs to thrive? I'm hearing more and more doctors are saying, I'm working harder, but making less. Many times that comes from simple inefficiencies at the front desk that lead to kind of catastrophic things in the actual chair side experience that just cause things to be missed that could be easier and better for you. So I'm excited to present to you tonight on all of this. And I just want to start with and preface with something over the years that has been kind of my tried and true philosophical understanding of how I believe the patient journey should work. And again, this comes from being in the clinics and being in the trenches with the teams. But, an optimal patient journey obviously isn't linear. It's cyclical, meaning that we want them to come back after they become that raving loyal fan. We want them to keep returning for that 5-star patient communication and then their schedule being confirmed. And so how do we get there? How do we make all of these things synergistic within a practice, so the patient doesn't feel lost in transit, or they scheduled and then they dropped off the schedule because they didn't feel valued. So this kind of cyclical idea is what I go in and teach practices and teams, because for me, this is the foundational element for everything else to succeed. And when your team knows their part in the equation for that raving loyal fan, and patient, referral, everybody starts to do things a little bit differently in the practice. So I just challenge you in this patient journey. I think sometimes in dental, we're so into those finite details, we forget the fact that our greatest revenue generator opportunity is that our patient becomes the referral source. And when they refer, when they mention your name, those are the best patients to receive in, right? All the marketing we could possibly do is great. However, it's never going to be as wonderful as when you have a direct referral, because those are patients that have heard firsthand a testimony as to why you're so good. So tonight we're going to talk about some of these elements, and I've tried to just touch on 4 keys. There are many more, but just things for you to begin to think about. And so the first part I want to talk about is accessibility and how accessible you are as a practice. In the past, we used to kind of consider new technology as a benefit to the doctor, a benefit to the team. And now we're in an era where it's no longer about just creating new tech in the practices as a benefit to the practice itself, but the patients are becoming demanding of it. They want things more accessible. They want better technology because they're used to it in other aspects of their life. So a few discovery questions to start with are: how are your patients interacting with your practice? What does that look like right now? Do they have accessibility on the phone? Can they text you? Can they send an email? Some practices don't have all of those options. They don't have accessibility at all of those points. And they also don't have someone checking them readily. What are the hours of your practice, and do they accommodate your patient needs? Have you considered sending out a survey to your patients with variable times and dates of when you could be open versus what you are, to see if your practice is currently meeting the needs of your current population? What I have found is some doctors are now working fewer days and consolidating hours because they are surveying teams and working the hours that are best for surveying patients and working hours that are best for the patients, and then having days off that don't necessarily fill because production is low. I recommend challenging that and seeing if that's an option for you right now. Are you allowing your patients to schedule online for convenience? Maybe some of you turned it on and it was a floodgate, and now you've turned it off because you lost control of your schedule. You're going to hear me challenge tonight some of the things that I've seen firsthand in tools like Curve Dental, where I can turn on an online schedule for my big ticket items like an ortho evaluation or a second opinion, instead of turning on all aspects of scheduling, to see how that works for you. And then also, how are you engaging with your patients for ongoing care and treatment plan reminders? I really want you to investigate and think about. You may say, yes, I'm already doing this, but I want you to take it a step further. Are those messages sincere, genuine, and an approach that you would personally use? If you're the provider, would you speak that way? Or does it sound like an automated robot that doesn't care and doesn't have a personal touch? And how can you make that different? So we'll talk tonight about some of those things, but with accessibility, interacting with your patients is everything. How you interact with them, how you speak to them matters. And sometimes it really requires a second look. An example I frequently will give is I had a practice that was working really, really hard to capture patients and get them into the practice and doing all of this kind of front end work to really build up that patient relationship. And then they were walking into the practice and they had 4 shredders set up at the front desk. And so all you could hear when you walked in was the sound of the shredder. And then immediately was creating this kind of environment for patients to feel anxious and nervous, even more than they already did. So my challenge to you tonight would be, what could you do to make there be a fluid connection between the phone call and the way that customer care is elevated all the way to the point when they're in the practice? So do you answer your phone within 3 rings? Is your team member smiling when they answer the phone? That matters because other people in the clinic, patients that are watching, are seeing that. And it's part of a contagious energy and vibe happening. Are they listening attentively to the patient? Have you created too many checklists that it's not allowing them to share the direct need that they might have? And have you created enough ways for them to get into the practice? And by that, I mean, sometimes I see practices that only have a new patient exam, a limited exam, and a recare. And those are the 3 ways you can get into the clinic. I would challenge that to say, are there options for you? Like I mentioned, that second opinion visit that's still classified as a limited, but allows for patients to feel this ability to come in and get a second opinion on that tooth. And are you wording it that way? You know what? I hear your concerns. It sounds like you really just need an evaluation on that lower left and a second opinion. Let me see if I can help you with that. So that's the attentive listening. Addressing them by name at least 3 times during the call. Research has shown and told us that individuals who have at least 3 recurrences of their name being spoken in a conversation have more than a 50% likelihood of re-engagement with whatever that business is. So if you know that, are your team members using that to their advantage to genuinely build a relationship, not just at the phone call when they call in, but even when they come into the practice? Mrs. Smith, it's so great to see you today. You're going to be seeing Dr. Smith or Dr. So-and-so. So, the continuation of that, even when they come into the practice, that you're doing this introduction matters. Are you ensuring that the office is offering those convenient appointment times? Again, back to what I mentioned before, surveying, listening. What is the best need for your patients, not just the best need for you as a practice owner? Schedule your patients within 7 days. This is a big one. I'm seeing more and more frequency of further out booking, mostly because they're having difficulty with insurance verification. There are, other systems, but Curve is one that I have found that is the best with insurance verification that happens within the actual patient visit. Instant verification that's happening in real time that combines AI technology and adds that to the patient file allows you to get the patient in sooner. The further you delay the visit, the more likely they are to cancel the visit. So you want to be attentive to that and watching that within your clinic. Prioritizing those emergency patients within 24 hours of their call. Is everyone in your practice aware of what constitutes an emergency? It can be one of the most detrimental things in a clinic if there's a team member or a group at the desk that don't fully understand what constitutes an emergency and how to get them in. I know that may sound silly and you're like, everybody knows what an emergency is. I challenge you to listen to your phone calls because sometimes what I see is kind of a lack of understanding and clarity by maybe a new team member to understand that, a swollen area in the mouth constitutes as an emergency, right? You can't book that 3 days out while you wait for a doctor. So just making sure everyone's on the same page as you and making sure that, the patient that's coming in for the emergency, and I hear this frequently where doctors will say, don't guarantee treatment same day. Obviously, if there's infection or something like that, you're the clinical provider and you have that clinical autonomy to know what is best. But I would also say, again, train up your team to speak lightly to those topics, to just say, the doctor will come in and evaluate and give the best, information possible for, the best outcomes for your mouth, and make it more about the doctor's expertise than someone at the desk. And I'll just add to this by saying one of the most important things that I've ever learned in dental, from a front desk perspective, came from a wonderful lady that I worked with that said, Cassie, I challenge you to make sure that your front desk teams aren't acting as the doctor on behalf of the doctor. And it was a really good statement because sometimes we don't know what's happening at the desk, where they're buffering or they're saying something or they're speaking to something void of the doctor. We really want that team to know that the doctor is the one that's going to make those decisions, and their job is to be the accommodator and getting them in when they can, but deferring to the doctor for all clinical guidance and relevant information. So just food for thought about how you're interacting in the practice. So the person answering your phone can make or break the practice. That means a good receptionist ensures that new patients are scheduled, they attend their appointments. A poor one may deter them altogether. I use the example of I had a front desk team member that didn't like the enabling of the text messaging in the clinic. So she created a message every time a text came in to reschedule or with a question. This office does not accept text communication. Please call Linda, and then her number. Well, I'm just going to challenge you with this thought. You may not know that's happening, but I highly recommend that you sit down with your team and do an evaluation of what those communications look like. When someone wrote that they needed to reschedule, were they responsive? Did they send a reschedule link? Did they find a like day, like time? That is my one gold nugget in this reminder to give you. A like day, like time means if I cancel on a Tuesday at 10, you offer me the next available Tuesday at 10, knowing that that seems to be a good time when I book. So a like day and like time to capture that patient that might otherwise be lost. So accommodating the patients, even if it may seem inconvenient to the practice. For instance, you don't want team members saying on the phone, oh, well, that's really close to our lunch hour, so we'll just see if we're able to do anything. Have them, again, buffer it with the doctor, making sure that the doctor is elevated and the doctor is who is communicated for excellence. So if someone's calling in and maybe it is an emergency and it is being booked close to the lunch hour, they're not mentioning that, but rather they're saying, the doctor will do an evaluation, and from there, the doctor is going to give us the very best next steps, always building up the doctor on the phone. I can't recommend that enough because it really does lead to this trust transfer chair side. So just a readiness for that visit and what that looks like. So this is an example of new patient scheduling, of just kind of a booklet that I created many years ago that I still use to this day in terms of language and building on. This clinic that I worked with to help it grow, we started to embed the word care into all aspects of the practice. Maybe you have other words in your mission that are of value to you. So I challenged them that every time they picked up the phone, they would say, thank you for calling. This is in their name, so I'll do it as myself. Thank you for calling. This is Cassie. How can I care for you today? And then they would pause and be silent and be ready to receive what was next. I can't tell you how frequently when you changed the language on the front end, it made for a different posture and experience with the patient. You don't have to necessarily use this exact script, but I would challenge you to listen to the way your phones are being answered. Is it happening quickly? Are they engaging in a way that is with a posture that's ready to listen? Hi, this is Cassie. How can I help you today with your needs? Thank you for calling us. Things that just feel genuine and connecting and not rushed. It's very important that you evaluate that. If they say they're a new patient, having some questions ready for your team to ask, well, tell me a little bit about how you heard about us, making them feel invited and welcomed, collecting things like the name, phone, email, and date of birth only at the very beginning, and insurance if they need to be, right then and there, they're wanting verification, otherwise sending an electronic form. I frequently see where the patient calls in and there are 97 things that now have to be asked of the patient before they can even get scheduled. Please put yourself in that patient's shoes. They're probably driving in a car or they're stopping for a minute before they pick up their kids. Would you want that? Would you want to answer 97 questions? Or would you rather have a digital form sent to you, answer 4 simple questions, and then go from there? Consider a reevaluation if you have a very large intake form on the front end of when a patient calls, because most of that can be put into a digital form like Curve, where Curve allows you to do it digitally and then it actually uploads into the patient file automatically. So it's ready to go and ready to view, and you're not hand keying in information. So, and another example, being prepared to train your teams on things like the patient says, "Do you take my insurance?" Actually, whether you're in or out of network, we will process a claim for you. In fact, many of our patients are out of network because with some plans, there's little different. If I can ask you for a few questions, we can see if our practice is a good fit for you. That may not be the perfect language for your clinic, but I'm giving you an example of a clinic where this was very valuable, because in their area, whether they were in or out of network, which was mostly schools, right? Like the school system was all around them, they still covered pretty much the same, especially for things like MetLife and others, whether they were in or out of network, by about, $10 to $15. That may not be the same for you. However, if you have trained your team, "Do you take my insurance?" and the team says, "No, we don't take MetLife," and they haven't investigated it fully, you may be missing out on the opportunity to care for someone, even if you are not in network. I have worked for many fee-for-service practices that are not in network, and I will tell you, one of the greatest deterrents ever is when a team member doesn't understand that all they need to do, all that needs to happen, is they need to pull up the insurance information, share the benefit summary with the patient in full transparency, and they may win the patient because the patient values the practice enough to know that going out of network to receive your care is still of great value to them. Let them be the one to decide that, and not the insurance. An example that I will use of that for you is a receptionist that I followed her calls for a week. And after a week, what we talked about was she immediately was telling them that they were not in network, but her mother worked for a clinic that was in network with that insurance carrier. So every time a new patient called, she was referring them to her mother's place of employment, a dental clinic that was about 15 miles away. Just make for certain that you know what's happening when that patient calls, so that it's not deterring you from gaining a new patient. Also, making sure that there is a personal level and a personal touch, going the extra mile to find out that insurance information, like I said, could be what keeps them in your clinic, even if you're not in network. So this is just an example of things that you can do to create a different culture at your desk. Unfortunately, what I see a lot is someone is training off of the way the last person did it. And unfortunately, the quality controls and checks didn't remain or stay in place over the transition of employment. So just revisiting it and making sure that you're ready to go. This is my favorite quote probably of all time when I'm working with a team, but it is, people will most definitely forget what you said. They will forget what you did, but they will never forget how you made them feel. My father was a dentist. He retired several years ago. And one of the things that I value deeply about what he trained and showed me as I watched him chairside is he would say to the patient when they sat down, forward facing, turned, looking at them, straight in the eye, not standing over them, hovering over them. He would say, "My name is Dr. Tallon, and before I get started with treating you today, I just want you to know that if at any point in the visit you feel that I have forgotten that your tooth is not connected to the rest of who you are, I hope you will let me know." And because of that, there is this transformative thing that happens where people felt valued and seen because he stopped and he cared. And when I train new dentists that are coming on board, with a practice, the first thing that I will say to them is make for certain that your posture is one that allows the patient to feel valued, allows them to feel seen, and that you sit and you get eye contact with them before you ever do anything inside of their mouth, because that is where the trust begins. And that's where you start to establish those raving loyal fans for the rest of the time that you're in dentistry. So thinking about all of that, there's this piece of the team, revving up a team, right, to start the day. And maybe your huddle needs a little bit of a jump start. Maybe it's time for something a little bit different in the mornings. I would challenge you to do the fun before the facts all the time, whether it is a team training, whether it is a huddle in the morning. I want to challenge you with this gold nugget that the fun before the facts matter. That means that your team has something fun to think about before the rest of the information is shared with them. Yes, you have a daily goal. Yes, you need to go over the prep for that crown that needs to be placed in the afternoon. But starting the day with things like birthdays, team celebrations, things that might be fun for them to be involved in. Like, do any of your patients have a birthday that are coming in today or within the next couple of days? And kind of revitalizing this fun before the facts. Make one person a champion in your office that's in charge of putting something together that allows you to do what I call a heart workout with the team. They incorporate the fun and they challenge them to have more sincerity and more vulnerability in your practice. The very best teams I have ever worked with are the ones where there is just this complete synergy between the doctor and the team, where they have fun first. So as you kind of are thinking about this, I put in here just an example of one of the booklets that I had done of, being sincere, talking to your team about sincerity and what that means of, the tone of your voice and that welcoming feeling. I worked in a clinic once where the phones were turned on silent at the front desk. They just turned the ringer off. And when I asked one of the team members why she wasn't answering the phone, she said, I don't know that there's really a need for me to. I mean, it goes to voicemail and I get it and check it later. And she was genuinely not engaged with what was happening at the desk. When you see things like that, you begin to realize that there's this revitalization that's needed within a clinic to help people understand their why. And again, some of those things can be as simple as, creating a better connection for them. And so giving them something to be thinking about on a day-to-day basis. And again, fun before the facts is everything. So consider the enhancement of your huddle. Welcome and daily goals, including that fun before the facts. A team cheer, again, that practice where I integrated the whole theme of care. We took it into the cheer and it was constantly supporting, always noted, realizing each need, every minute devoted. I know it sounds cheesy, but I'm here to tell you the practices that are thriving today are the ones that are redefining their why. Then go over the daily goals. Try to give just a few short KPIs that you would like, that, key performance indicators that you would like to cover. For me, one of them that I frequently say, just keep this top of the list and then let the others kind of fall to the side and don't worry about them, is that per patient value, how much money you're making per patient, because a lot of it can be tied to simple things that are missed. For instance, as you're going over a huddle saying, hey, I noticed that Sally's coming in for a cleaning today. I just wanted you all to know that Sally's also due for her crown and we didn't have time with the doctor, but if time opens up, we'd love to get Sally taken care of. So it's not about overselling or increasing money to the clinic in a way that isn't ethical or the right way, but just being accommodating, teaching your team to be accommodating. So, thinking about ending and starting your huddles in a way that just feels more cohesive. And again, including those fun before the facts. Then I want you to be thinking about, tied to all of this with the conversation and the way the huddle begins, the phone aspect. And is the phone ringing to the point that your team can't fully answer it? And where is the phone ringing 2 for messages. This is a very important slide. I know it's a little overwhelming, but I hope that you'll gain some gold nugget out of this. Every practice deserves a phone makeover that might be preventing your communication from happening the way that it should. Thinking about your phones being tied to a process instead of a person. I frequently see phones that are, tied to one individual. And if she were out for the week, none of those messages would get handled until she returned, likely resulting in losing patients. So Curve has an incredible tool where you can integrate with Mango, and they do a screen pop that allows you to see the caller coming in and also to group types of calls coming in the way that you want. So this is just an example of a way that you could group calls coming into your practice. New patient calls could be designated to 2 people that you know are excellent at taking those calls, again with a simplified script. Recare calls could go to someone who's very fast at scheduling recare, right? Treatment planning calls, are they going directly to a treatment planning coordinator who's then routing them accordingly if there are questions for the doctor regarding treatment? Updating insurance. That could be the person that's verifying your insurance. They are specifically getting those calls. And again, these are prompts on the front end when a patient calls in that can help simplify things and route accordingly. And people will say, I want a live person to answer instead of a computer generated voice. That's great. Let someone answer it, but then immediately when they say, I'm calling to schedule recare, one moment, and then you transfer to the appropriate lines. Non-revenue generating calls that often are tying up the phones are labs, prescriptions, billing calls, vendor calls, and community calls. A huge gold nugget for you is the billing call questions about my bill or vendor calls, having those not go to a person, but directly into a voicemail where the voicemail says, we check this voicemail 3 times a day and we promise that within 24 hours, you'll hear from us. So literally setting up the non-revenue generating calls that are still necessary for the clinic with a quick voicemail answer that allows you to start taking control of the controllables and answering those calls at a time that's most effective and efficient for your team. Just pre-built with the voicemail. Immediately when the transfer happens, they get that message and know, okay, good. In 24 hours, someone will get back with me. So the power of that patient call is then able to happen when we're really able to focus on the goal of the call. So now that we've talked about eliminate those other variables. I mean, I can remember a day where I was in an office and someone called in like selling implants, and they're on the phone with the front desk, and I'm sitting there next to her, and this new patient walks in and she's having this full conversation with a vendor, and she's not greeting the new patient coming in. And she's like, just a minute, you can have a seat. Like she's talking to them and stays on the phone with the vendor. Well, long story short, she gets off the phone and I said to her, I said, that patient's right here. Like, talk to me about what you're thinking. And she goes, well, I don't know. I mean, the doctor has said that, not to turn away those vendor calls coming in because, doc is interested in whatever is out there to offer. Yes, but I don't think your doctor would want you to tell the new patient to sit down and you'll get to them later while you're listening to someone who isn't part of what's making the practice money right now. So again, remove that obstacle, put that into the voicemail, make the vendor calls immediately go into a bucket that someone listens and answers to later so that you can find the gold in the call of what's coming in. So patients often will call around a single need. And I love to train teams on the fact that it's an opportunity for so much more. I will listen to calls all the time where a team member will get the call and someone calls in and she'll say, hi, thank you so much for calling. And the patient will say, hey, do I have an appointment on Thursday? Yes, you sure do. You have an appointment on Thursday at 11. Okay, great. Thanks. Goodbye. She hangs up the phone, and sure enough, that patient needs to take care of a balance before they came in. There's a billing note. They have children that could schedule, and there's holes in the schedule, right? And she also has treatment available. And just lo and behold, doc has an opening for treatment. So does the patient need more? And finding the gold means that with every call, they find more gold than what the caller just called in for. I've actually run, gamified this and had fun campaigns with teams where, they get to share in morning huddle who found the most gold. I had 7 calls yesterday, and of the 7 calls, this is the gold that I found. And whoever finds the most gold gets this award. I had a award that was the GOAT award, the greatest of all time award, and they got to keep it on their desk until the next person matched the amount of gold. I'm challenging you with the thought that if your teams understood that it's more than just picking up the phone and answering a single question, it's about the continuum of care, right? Did they need to schedule? Do they need treatment to be done? These are the questions that I would have them ask. And I think when the team gamifies it and gets excited, you could even give away gift cards. They start to get excited about finding the gold in those patient calls because it's so much bigger than that. And this is, again, for that patient that's calling you for something simple, making sure that you've evaluated the full family file. I love in Curve, there's a pop to the side that's just like the patient file. So when they call, you get a screen pop, you click on it, you still see the schedule, but you have all the details of the patient right there, right in front of you as you're taking the call, which makes this very easy to accommodate. So simplifying your operations means that you're making capacity, right? You're creating capacity to handle the marketing. And if you're marketing your practice, many times what I see is the marketing will show all of these, impressions and click-throughs, and you're going, that's great, but I'm not actually seeing any ROI on that. And many times what that is it's the automation of the intake that's missing. So you may be pushing out a huge marketing initiative, but I would challenge you, okay, marketing, the best marketing I've seen in practices isn't this wide span of find a dentist near me. It's taking a specialty like All on 4 and then pushing out your communication to sync and match whatever that is. So if I'm advertising All on 4, I create an All on 4 online scheduling link. I allow that to be what syncs into my schedule, which Curve does seamlessly. My digital forms automatically send to the patient and welcome them as soon as they've scheduled their visit. You have the ability to embed into your messaging, both from a text side and an email side, a video. You could even have a video that says, hey, thank you so much for thinking about implants and choosing our clinic. We can't wait to share with you that we have the best system for implants here, and we are the best in class at what we do. Like literally an introduction to what they're getting ready to come in for. It allows them to personally connect with you and keep the visit. And then this clinical efficiency is tied to that marketing, right? Maybe you got them in the chair, but you still didn't see a high level of conversion when they're chair side. That digital treatment plan acceptance, which Curve allows you to send it straight to the phone while you're speaking to the patient. They sign it and accept while you're there, and then it goes right into their document center. Texting to pay, so there's ease of payment instead of having this complicated measure of how they take care of their bill. And then even the automation of follow-up. Maybe you got them in for their first visit, but there was not a strong follow-up that came after that. You can match messaging to the CDT codes of what was the diagnosis that was given. So you were chairside and diagnosed perio, and so now I'm sending out a message specific to, perio and what we recommend and what the warning signs are, for increased severity with perio as well. So being aware of that. That means even the confirmation process needs to be kind of this fluid response. Why is it important? Because the patient knows the importance of keeping their schedule. It will help reduce your no-shows and keep everybody on track. So this is, again, an example of what that looks like, creating this confirmation process that's both digitized with something like Curve Grow, where they're communicating to the patient, it's being saved in that communication log, and also physically calling. So that means if we're doing those elements on the front end, that now we can kind of think about this key of enhancing the patient experience, giving you the challenge to ask, are you welcoming them? Are you managing those first impressions when they walk into the clinic, and creating an environment when they walk in the door that doesn't have shredder sounds at the desk that are interrupting, that allows for those vendor calls to be mitigated and pushed somewhere else so they're attentive? And really, are you extending the warmest of welcome? For me, one of the biggest pieces of that and that enhanced patient experience will always go back to announcing the doctor when they're checking in to say, Mrs. Jones, thank you so much for coming in today. Dr. Quigg cannot wait to see you. She's an incredible doctor. We absolutely love having her here. We know that she's, is one of the best in the area. Like literally like building up this rapport with the patient before they ever make it to the back in full sincerity, but doing it in a way that literally is, again, that trust transfer. So first impressions will significantly impact perceptions, relationships, and outcomes. Literally, it allows everything else in that first impression to transfer the trust. So you've got this in your handouts, and I won't go deep into this, but these are some of the powers of a first impression with sources for you of where this has, been tried and true of how important it is. Remember what I said about saying the patient name 3 times and what that means for a second encounter? The influence of this from a healthcare standpoint and what this looks like leads to better patient trust and is going to be a part of why that patient accepts treatment, because they feel valued, they feel seen. And simple things at that check-in, like a bottle of water or offering them, a lip balm or something, just something to say, I see you, not, hey, I'm on the phone with a vendor, take a seat. That engagement will lead to the rest of what happens in your clinic. So, setting the expectations for that personalized patient care, a clear visit overview of what's getting ready to happen, just to say, they're there for a new patient visit. Maybe you give them a tour. Maybe you don't have capacity for that, but you just say, Mrs. Smith, the next thing that's going to happen is Judy from the back is going to come up and she's going to take you back to do some x-rays. And then from there, the doctor will come in. Like, just simplify it, make it easy for them to understand, and have this enthusiasm that builds trust and really pushes that forward. And also be ready to have a purpose and a plan for that patient. So even your assistant, when they bring them back chair side, the assistant isn't saying things like, well, I'm still doing tray setup, or this is only my second week. No, every time there is a handoff, that assistant now is mentioning the doctor's name again, how great the doctor is, and how they're looking forward to providing them with the best in care. They're telling the patient what to expect. When I mentioned that about the word care being integrated into all aspects of the clinic, I would have patients that would say, I can't believe the way that you care for us. Like, or you care for me. Well, yeah, we told you the word care over and over again. So we built that, we ingrained that into you. There is power in using words and experiences that they feel so that they begin to receive it and believe it themselves. So a warm welcome, a visit overview, patient engagement, and then that post follow-up. Those are the things that provide excellence. And again, I've given you examples for your handouts. That means that you're enhancing that greeting when they come in. Saying their name right away matters. The digitization of the intake form, making it simplified. A welcome gift that I shared, a bottle of water or a lip balm can suffice. It doesn't have to be major. But when the forms are done digitally, it allows for you to free up a lot of time because they can be sent sooner. You also can utilize a kiosk. Curve does that, where you can fill it out on an iPad right there. And just a comfortable environment where they feel welcomed. Consider also when you're doing your intake forms, your one gold nugget, combine those forms together to make it easier. Many times I see 7 or 8 intake forms that could be in one, that would allow for just a simpler experience for the patient. If you've never been a patient yourself at the clinic where you work, I would challenge you in the next 2 weeks to be one. Call to book your appointment just like you would a patient. Sit in the lobby just like a patient would, and then get seen. Like if you're in a clinic with other providers, allow another provider to see you. There's something very valuable about that, being seen and heard from that way, that part of it. So maximizing the patient value means that you're able to group the CDT codes. You're making sure that there is an established point of diagnosis to streamline and get ready for things. Treatment plans and options that are, available for financing being shared front and center. Reappointments, are they being streamlined for patient communication? And transparency with your financial process. I've seen many times in a welcome letter where the financial process is shared, as well as the availability for financing, just so front and center they know, okay, the copay is due at the time of service, I have availability to care credit, and I know what to expect. That price transparency will help build trust, make sure it's happening before they even set foot inside the door in a very inviting way that doesn't limit them from booking with you. When you think about those grouping of codes or CDT structure, I want to challenge you that there are several ways that that's coming into play. This is, again, an example of a booklet that I did where it's just talking about the tips to prepare for diagnosis and getting ready chairside. One of the things that I see that hinders this the most is when a team member in the back is having to fill out what the CDT codes are for the visit because it didn't happen on the front end. So especially for intake types, what I love about Curve is I have the ability to group all of my codes into one appointment type. It propagates to the patients that's been scheduled, shows me my production value increase once it's scheduled. And now in the back, I'm focusing more on a preparation for diagnosis than I am searching for codes. So once this happens and the diagnosis is happening and the clinical team is working to get that diagnosis ready, inside of Curve, I have the ability to come in and create code groupings and shortcuts for the treatment plan even. I recommend doctors use their top 10. They put their treatment plans together. What are the top 10 treatment plans they recommend? Select a tooth, and then they push that button, and it propagates to the treatment plan all of the code that the doctor prefers. So if you do an extraction, you normally recommend a bone graft, that's in there as well. Thinking about these things that might be limiting your preparation for diagnosis or even once that happens. So this is, again, a checklist for what your treatment planner should be thinking about before they, present to the patient. Having the numbers ready, financing options. These things are easier to achieve when you do that. You would call it like explosion codes, but they're treatment plan shortcuts so that the team is doing less of the guesswork and running around trying to figure out what it is you've recommended for treatment, and more of a preparation to present so that it's done in a way that really is a full trust transfer. So retention is the last key. And again, I'm going to run out of time, but this to me is the heartbeat of everything. Your retained patients are the ones that produce the most for your clinic over time, but also become the raving loyal fan that builds the practice up for all of the years that follow. And I feel like what happens today is the teams, especially newer ones that don't have a background in dental, they've forgotten that the human touch, the pieces of this, we can still be high tech and have automation with a high touch where we're really making sure the patient feels valued. Are we encouraging the ongoing care? Are we talking about it chairside and booking that for the patient before they ever leave? Is the pending treatment managed in a way that's soft? So if they didn't accept, we say, you know what, if you don't mind, I'm going to follow up with you in a couple of days with just some additional options because I really want to make sure that that tooth doesn't get worse for you. Training up your team to have a high level of compassion where the patient doesn't feel sold to but feels valued and heard. So retaining an existing patient is 5 to 25 times cheaper than acquiring a new one. I would just say that it is infinite, right? That's a wide span that Harvard shares, but it ultimately means your most effective spend in a practice is to focus on retaining. So once you market to someone, getting them in the door and keeping them. Increased lifetime value, and they're your greatest referral. So a loyal patient is your advocacy and referral. They're going to improve your feedback. Think about, have you made any decisions in the last 2 months as a consumer that didn't involve reviewing something on Google before you did it yourself? The same is going to be true with your dental practice. So making sure that they're becoming this brand ambassador. Review this about why your Google reviews matter. I can't stress this enough. And look at the fact that research is telling us that these patients are choosing based on these reviews. So asking your patients, there's an incredible tool called Different Kind where you can survey your patient first, then ask for the review. Curve allows you even to select and share that Google link when the patient leaves and collect their review. That is incredibly important for building your online presence. And then just be ready for, creative ways to do this. I've seen in practices where they actually give them a card to complete their Google review. And if they mention a patient name, like in the practice, they get extra money each month if their name is mentioned. So a team member could get $5 more per review, creating ways to incentivize that to happen. That strong relationship is the cornerstone of everything, and it will ultimately lead to the best possible outcome for your practice growth because now it's not just driven by hearsay or looking at strictly just another website and making a decision because your marketing and your AdWords pushed them there, but truly they heard an experience and you created that for them. So don't underestimate the power of those reviews and what they can do to lead to more positive impact on your practice. I think we'll open it up for questions. I tried to, at the last here, give some time for those questions, get a little passionate about these topics. So anyways, we're ready to go.
You did perfect. Cassie, a question from Lisa. How does it work with out of network? If the insurance pays 80% for filling, you would only collect the 20%, and do you go based off the contracted fee with the insurance or your office fees?
Yeah, so that's a great question. You have to follow whatever insurance. If you're in network with an insurance carrier, you have to follow what that agreement is. If you're out of network, obviously your fees are the same, right? Like you choose the fee that you're offering. That's where I would really be keen on recommendation of your financing options right out of the gate, and also speaking to the fact of the quality of what they're receiving if they go there. So work in tandem with the rest of your team to make sure that before you jump through hoops or find different ways to adjust fees, make sure you know what your contractual status looks like with insurance.
Terrific. Thank you. A question from Laura. How does Mango Curve know which ones to send to billing and vendor calls?
Yeah, so it actually you do it through propagation of prompts. So that means that you have two options. You can either set up like groupings. So if someone calls in and they say, I'm calling for this, you can say, okay, in our call tree, if we push 1, it's going to go to these individuals for a vendor call. Or what I really like, and I don't think people are against this when they call in and receive it. I've heard, negative feedback, but when the patient calls, they get an automated voice that says to them, you could record it yourself too, but it just says, thank you so much for calling our clinic. If you'll press 1 for, new patients, that goes within the call tree. So you're prompting the patient to choose, and then they select the button when you do it that way, and it goes into that call tree.
Terrific. We've got another question here from Karen. As an out-of-network office, how do you simplify the new patient phone call when we'd also like to gather insurance information so we can send off, I think it's pre-auth, in a timely manner? Oftentimes, patients don't fill out their digital forms until the day of or day before their appointment, not giving us enough time to receive the pre-Ds back. We use Curve as well and have found that the instant verification may not be accurate for OON offices since we aren't contracted or out of network. Since we aren't contracted or accepting their fee schedule. Thank you.
Yeah, no, I think that because you are out of network, there are difficulties around that and you want to get a pre-D done. I would have someone within your clinic be an insurance champion that's calling to get that insurance information before they come in and challenging that with the pre-Ds. It really is about process, right? Like, I know it's hard, but just saying, okay, every day at 2:00, I have this team member that's going to audit those patients that have yet to complete their forms and pick up the phone and call or text. You can send a very fast text and say, we need this information in order to be able to provide you with the best level of care. That really is the best methodology of how to do that, because when you're out of network, you have to have the right information before they walk in the door, and you just need a champion. I had a champion in office. Her name was Emily, the best of the very best. She would chase down those benefits before they made it in the door, and it's everything. So I would just say identify the right person to support you with that.
Terrific. A comment from Jennifer. My office has a huge turnaround with the front desk. I see a new face twice a month. Not a good experience for my patients, but hurts the hygienist as well.
Yeah. Oh, that's a great point to make. I'm seeing it as well. And I would challenge you to do 2 things. 1, exit interview the people that have left about why they left. If you can get that information, it is likely they will tell you something like, it's just too much. There are too many hoops to jump through. And then sit down and simplify with your doctor and with your team what that looks like in terms of creating a better plan at the front desk. Maybe you need to take some things away from the desk and hire someone externally that does them. Hire a third party that's processing insurance claims and billing. I mean, I've seen desks where they're responsible for taking in the mail and sorting it and posting the payment, answering the phone and checking someone in. Just take time to sit in their shoes long enough that you might want to actually automate and sort out some of those things.
Let's see here. How do you compare Mango Curve to Weave?
Yeah, so Weave, I have found Weave to have a high rate of error when it's posting inside of the actual schedule. And what I like about Curve is Curve's integrated solution with that appointment going in allows for the visit to hold CDT code value and production. So it's a different method of doing it that really is leading to just a more seamless process. And Mango versus Weave in terms of phones, it's just hands down a better solution because of the way that it allows you to simplify with those prompts. They are built to streamline. Like that's the way the company works. I think Weave has oftentimes been cumbersome. And again, I've had a greater rate of error with implementation.
Cassie, who is the reviewer that you were talking about? Did you say it was Different Kind?
Yeah, it's called Different Kind.
I'm familiar with them.
And they survey patients, and I have found huge value in that. If you're seeing a high rate of turnover with patients, or you feel like that something's missing in a quick survey, I have seen massive shifts and changes from that. So,
okay, we've got one more question here. What's the best way to diffuse a rude patient? That's a great question.
Ooh, that's a great question. So, when I was an office manager, I would always laugh that for whatever reason, I could be anywhere in the building, and I was always nominated to go talk to the rude patient. I'm like, this is wrong. There, I 32 employees. We should all be good at conflict resolution, but they would find me in the bathroom. But needless to say, I trained my teams on conflict resolution to, number one, if you can, find a space that's separate from the open area of the front desk. Just say, Mrs. Smith, do you mind to come around over here for just a moment? Like if you have a treatment planning room, and then to pause and hear them. If they're being incredibly rude, to say, I heard you say, repeat back to them, I heard you say that you do not feel like that we are being transparent with pricing. Can you tell me a little bit more about that? When you get into a little bit of that analytical side, they have to slow down their words to share back with you what's going on. And then if they're still being rude and irate, you can just say, I hear you. What I hear you say is that you're still very upset with us. I would like to let you know that you are welcome to leave and go. And then let's follow up when you feel like that we can have a good rational conversation about this, because I certainly want to make this right with you, but it seems like right now may not be a good time for you. So using language that kind of empowers them to feel like they're still in control, even though you've just made the decision to be in control. So that to me has been the biggest turnaround, is just, really from the psychology standpoint, helping them to feel heard, but then handing them kind of the ticket to say, we would certainly love to take care of you, but it doesn't seem like right now is a good time to have this conversation.
I think that's a good approach. I present a class, and by the way, we've just put the passcode in the chat area for you all. There's a point sometimes where there may be a patient who oversteps rude.
Yes.
And you have to understand when that is, and have policy from the top down about zero tolerance. There's no excuse for abusing your front office staff or anything, and that can lead to escalation of other problems. So I totally agree with you on that approach. You want to try to diffuse it early on, and let them try to explain it in their words. Yeah.
And no trying to share your point. It's just, I heard you say this.
Right. Exactly. Last question here while folks are getting this passcode. How would you explain treatment plans to patients? Do you educate the patient while providing the estimate?
I think that's a great question. And I think that you have to know what the patient wants in order to do that. So you need to ask the patient before you ever present the treatment plan. We're so grateful for the chance to care for you today, especially if it's a comprehensive exam, and just say, doctor has recommended a lot of things. I'd like to go over that with you, but I certainly don't want to overwhelm you. Would you like to know the first few steps, or would you like me to go over a little bit more in depth? We forget sometimes that patients are incredibly squeamish and don't love the idea of a needle or what might need to happen to their tooth. And I've sat with treatment planners that are like, so when we prep the crown, they're going to drill down. And I'm like, no. Like most of us are
even fearful. I don't want to know what you're going to do. Okay.
Most of us are fearful of the dentist. So instead,
just do it. Right.
Instead, simplifying your language to say, the doc is going to put something over that tooth to protect it before it gets worse and down into the nerve, and just simplify your language to not be overly into dental language, but certainly feel the room. Know what your patient wants to hear before you say it, because I feel like we don't ever listen first. And then they're so lost halfway into the treatment plan, because they're like, I just wanted to know, this front tooth is dark and I really want it to look better. And we're giving them, 20 things to do.
And that's why I think it's good to sort of identify, what is their chief complaint when they come in the door. Right. Sometimes we don't address their chief complaint. We may see something that looks 100 times terrible, but they're coming in because they say, hey, I want a glamorous smile like,
that's right,
whoever. And we're talking about, some obscure thing that's important to us. So we have to really zero in on why did they come in that day and keep focusing back on that. That's sometimes a great motivator for the rest of your treatment plan.
Yeah. And I think that perio is a great motivator for a long-term patient. We skip the perio part and go right into the one crown thinking we'll get the one bigger treatment. And what we forget is, vanity is everything. When a patient can see what's left behind after the calculus is removed and they now have a different smile, they're like, oh, I need to have more work done. And so they become a very loyal patient.
That's right. I always tell a story. A couple years back, I went to a periodontist because I wanted an implant, and he was associated with a cosmetic dentist. And I said, "Hey, look, I'm on my third rehab here. I'm a boomer. I want glamorous. I want a glamorous smile. So for the last remaining years of my life, I want a glamorous smile." And he treatment planned gold crowns. And I'm sitting there like, what? You got to be kidding me. I had the gold removed years ago, and so it was clearly that they just he didn't look at the chief complaint that I had or my wants. I would have compromised. I know that I grind, but that part of it just escaped me.
Yeah.
So yeah. Everyone, I want to thank Cassie. Please join me in thanking Cassie for this presentation. It was incredible. And we have great comments here, Cassie, for you. And let's go ahead and we will bring our next presentation up with Cody. And I do want to remind everybody that passcode on the screen, 793284, please write it down. And Cassie is going to go ahead and we're going to go ahead and transition over here to Cody. So thank you very much, Cassie. I appreciate it. Okay, so we have Cody here with Curve Dental, and I am going to, at the same time, ask Jake to put up our next banner at the top of the screen where you all can reach out to Curve and learn more. So you're going to see that banner change colors here momentarily to a blue banner. And at this time, I'd like to introduce you all to Cody with Curve Dental. And she's going to go ahead and give you a really nice presentation on how Curve works and also reiterate a few of the things that Cassie shared with you as well. So welcome, Cody. Thank you so much.
Thank you so much for having me. And as mentioned, my name is Cody. Before coming to work with Curve, I actually used Curve in a 3-location practice for about 6 years. So I'm excited to walk you through a almost teaser demo, really highlighting those areas that Cassie spoke to specifically. But I do always like to start with the UI, or that user interface, when you log into Curve. So what you're seeing here is something very similar that you can see whenever you log into Curve. Everything throughout the software is going to be low to no touch, which is just going to mean less clicks to get things accomplished. And it consists of 3 main areas. So you're going to see a schedule here in our main screen, which is fully customizable to whatever suits the practice's needs. You customize how many operatories you have, the labels of those operatories, time increments on your schedule, and then of course the colors of your appointments. You'll have your mini calendar down here to the bottom right. But over here to the far right, this is what we call our sidekick. And this is what you're going to use to navigate throughout the system. You can see that all of the areas that you can access for your patient's chart are clearly listed and printed here. The patient's name's listed at the top. So if this family had patients or family members tied to their account, you can simply click on the name and that gives you access to those in the drop down. What's also great here in the sidekick is the more arrows that you see next to each module is going to allow you to get summaries. So examples I always like to show is if we want to take a peek into the patient's billing, we can hit that more arrow. You're going to see patient balances as well as insurance that's still out. Another great example is if the patient calls and we need to update personal information, maybe they've moved or changed a phone number, we can hit that more arrow next to the profile. And right here in the sidekick is where you and your team can very easily update and capture that new information without having to leave the current screen that you're working on. Now, patient engagement is an important part of any practice, and Cassie touched upon the importance of patient engagement throughout. So I do want to talk to a couple key areas where patient engagement really streamlines how your day-to-day will work with Curve. Now we'll start with online scheduling. Right from our appointment view, you'll see that a couple of my appointments have a dotted outline. That's just going to be a quick visual cue for your team to know that those appointments were booked online. And as Cassie mentioned, you have complete and total control over the types of patients that can make the appointments and the types of appointments that you're allowing them to make. So my example here that I'll show you is going to allow new and returning patients to make appointments. New patients, I only give them the 3 different options. So that consult, emergency, or comprehensive exam and x-ray. It'll give them the first availability to whatever parameters you set for that appointment type. But if that day and time doesn't work, they can only pick different times of day that might work better. But once they find the good time, they can just plug in all their personal information. If you want to capture dental insurance now, you can absolutely do so. And once they schedule that visit, that's when it will go back on your books. Again, that dotted outline that we'll see here does let us know that that appointment was booked online. Your team can now open these appointments up to view any insurance notes or appointment details listed. But once you decide this appointment's good to go, you'll be able to right-click and verify that booking. And now this patient will receive all of the automated reminders from Curve. Now you'll be able to automate those reminders specific to those patients that booked online if you choose to do so. You're also able to customize those messages for any other appointment type that you might want to. If I came into the patient engagement screen here, you'll see that I have campaigns set up for my appointment reminders. I even have more detailed ones just maybe for my 3-month perio patients. You choose the sequence and frequency in which they go out. You can solicit reviews, of course. I have a Google example here, but you choose the platform. So Facebook, Instagram, Yelp, wherever you might want to send them. You can really automate the process of getting your patients back on the schedule for recare. So Curve can send out these reminders to patients that are coming due as well as overdue. You can customize it to the frequency that they're on. And you can even go ahead and put that link to schedule online in those reminders, making it very easy for the patients to get back on your books. You'll, of course, have two-way texting. Your patients can text you first. You can search your database for a patient. You can even type in a brand new cell phone number. So Curve users love this because it does not have to be a patient of record for them to type in that number and be able to have that back and forth communication. And then lastly, our smart action list. The big thing I like to point out here is going to be the customization of reminders throughout the office. So I always say that this is going to be the tool that gets rid of all of those sticky notes that are all over all of your desks right now. You can set that task. You can assign a task that this patient, assign a patient that this task might be regarding, but then you can assign this task to a team member. That way, when individuals log in and they go to the My Tasks option, they'll have a detailed list of the things they're responsible for. And this is really just going to help streamline those day-to-day tasks that you're taking care of. No one has to run back and forth to leave that note on the doctor's desk. They can easily check what they might have to take care of and go ahead and mark it as completed. Now, coming back to our schedule view, I do want to go over how easy it would be to attach those electronic forms that Cassie mentioned. Right from your Sidekick, you'll see that the forms option is right here. You can hit that more arrow and see the add form. Now, Curve's forms will be fully customizable. We will have templated ones that you can use. You can edit those templated forms, but you can also create your own forms at any point. You'll also be able to group those forms together. So I have a new patient packet form, for example. These forms will go directly to the patient. They can fill them out before they come into the office. And the big time saver here for your admin team is once they start filling out these forms, all the information does flow directly back into Curve. So if they're filling out any patient demographic information, it'll plug into their profile. If they're marking any allergies, medical conditions, even medications they're taking, it will attach these alert flags that you see here. This way you can hover over them to see exactly what allergies, medical conditions, or medications that they might be on. And then it saves a copy to their chart that we call files and letters. Think of this as that document center. So that signed copy would save right here, and it would look just like that scanned document. So you would see everything that patient completed, and it would also hold that signature and time and date stamp here at the bottom. Of course, we do want to streamline how we're capturing insurance information for our patients. Getting those eligibility breakdowns quickly is going to be very imperative, especially if we can get it done before the patient comes in the practice. So inside the insurance modules where you can easily hold all of the insurance policies the patient may have, you can track usage, you can come in and update coverage details. So this is where we're putting in those percentages. You can even get as detailed down to dollar amount per code. And when you're wanting that eligibility breakdown, you're able to capture that right inside of Curve. Whichever policy you want the breakdown for, just a right click and you can submit that request. And it does come back in within seconds. So now you can come in and view that eligibility breakdown. So it's going to have all of the patient's coverage details listed here. Now you can review any previous pull that you might have requested, but you can also check this as often as you would like for your patients. Now, for the sake of time, I do want to show you a couple more areas before we wrap up with any questions. And the big one I want to share here with you is what Cassie spoke to several times, and that's going to be the treatment planning and, of course, the treatment plan presentation inside of Curve. So starting over here to the left, this is going to be our treatment planning tool. And these are those shortcut buttons that she mentioned. They are fully customizable to all of your go-to procedures. Think of them as that blast code feature. So I have a core buildup and crown example where I can select the button and I can click on a single tooth or multiple teeth that I might want to treatment plan that on. You'll see that it's added to today's visit here. Now, right here inside of Curve, you can right click and go ahead and print treatment plan or send it for signature, which will allow it to go to the patient's text and or email. But another point that I like to show is that you do have the options to give those payment opportunities to the patient. So if you're having maybe a discount for paying fully up front, you can go ahead and take that 10% off. If you're offering any sort of in-house payment plans or offering even that care credit, you can put that different information right there on the treatment plan. It can go directly to their email or to their phone so they can sign for a signature. They'll also be able to use a tablet in the office. So if they wanted to just have that view on a tablet, they could absolutely do so. I will show you a print screen view of that treatment plan so you can see how it's laid out and just the customization that we have with it. So if I were to go to that treatment plan option, again, you'll get the same pop-up box that we just showed to send out that text. But you can also customize the verbiage that the patient is going to see on that treatment plan. So instead of having a confusing dental code or dental terminology, you can put it in more layman's terms. So like tooth colored filling, you might not necessarily use cap anymore, but instead of having that confusing dental code with crown, porcelain, ceramic, you could just put a simplified crown version there, making it very easy for the patient to understand exactly what you're presenting and help with that treatment case acceptance. Now, the last area I want to go over with you is going to be the billing inside of Curve. And that's going to be able to show us our invoice-based billing. And I apologize, my screen froze here real quick. Let me refresh this to see if I can get it pull up for us real quickly. All right, apologize for that wait. So we were able to get that pulled back up. Now, if we open up the billing section of Curve, what the big win with Curve's billing is the invoice-based method. So where you might have that line by line in chronological order, this is really going to simplify it. Think of each invoice as the date of service. Now, any particular payments that are made to that invoice are going to be grouped together. And with the statements, this is going to allow you to send out these statements via text and or email. Your patients are going to be able to open and view these statements. One, they can clearly see it's coming from your practice. They can see exactly what they owe and why they owe it, and they can make a secure payment. And that payment does post directly to the billing ledger inside of Curve. And you can do these individually, as you see here, per patient ledger, but you can also run reports, whether it's biweekly or the end of the month, and blast out emails or text to all of these patients that owe a balance, which really helps that admin team stay on top of the AR and make it very easy for your patients to send those payments back into the practice. Now, I know I've gone over a little bit of time because I did want to leave a couple minutes here at the end. So if anyone does have questions, I'd be happy to go through and answer those now.
I'll go ahead and read those for you and some of the comments. Cody, thank you. Let me go up to the top here. This is from Maja. I have Dentrix that provides online scheduling, texting, appointment reminders. Why do I need Curve? And we had a comment here from Laura. Maja, we just switched from Dentrix. It was a lot of work, but worth it. Curve is much better integrated. It cuts down on work that my admin team has to do. I would also eliminate one position at this point. Also, I was paying add-on fees for a lot of those services and only one cost with Curve. So anything you'd like to add to that?
Yeah, I think on the majority of our demos, we get that joke that they could possibly lose, especially someone up front, because it does automate quite a bit for you. And for add-ons, for people that might be using third parties to kind of help get those online schedulings available, and of course patient engagement, you're not having to have any of those add-ons because they are all part of Curve.
Great. I do want to remind folks too, if you tap on that blue banner at the top of the screen, it will take you to Curve Dental's landing page also, and we have the link in the chat area, so you can bookmark that URL and take it back to your practices tomorrow and share it with your practices. Michael would like to know, is there any way to change the text on that welcome for self-scheduling that doesn't match our personalities?
So you can actually change the coloring, the pictures, as well as your logos for that. So you can customize that quite a bit.
Great. Any other questions here? We have a lot of office managers on this evening too, and that's great, Cody.
Yep. I will say that this is just a teaser of a demo, if I will. So being able to get your office together and go through an entire demo takes about 30, 45 minutes. So if it did spark interest, I would absolutely recommend the team doing that.
And they can do that by tapping the banner and setting up that demo time with Curve. Any other questions or comments? You did a terrific job, Cody. I'm sorry we couldn't see your face this evening.
It worked out perfectly before, but I do apologize for that as well.
Not a problem. I appreciate, again, you being here, and definitely Cassie and Curve for supporting this webinar this evening. If you have any questions, please be sure to reach out to Curve, and you can do that by taking or tapping on that blue banner at the top of the screen. I'll be reposting the code also for those of you that need to write it down. Thank you so much for being here, Cody. I really appreciate it. We've got some great comments for you. So,
yes, awesome. It was a pleasure. Thank you all so much.
Thank you. Okay, we are going to go ahead now and repost that code for you all that you're still here. It's 793-284. So Josephine, you were asking about it. And I'm going to go ahead and repost both for you. So if we have a few folks on here and you did not get the code, be sure, please, to write it down. And you can complete that quiz right now and not worry about it. This is working. It may take a minute or two for you to receive your CE credit verification, so give it just a minute. So you'll see the link in the chat area and the code. The quiz is right in the chat area, or if you go to our website, dentalceacademy.com, you'll see the quiz also at the top of the screen in the nav bar. Seven 793-284. There's the link to the quiz. We'll leave it up for one more minute and then we will tell you good night. For those of you that are still on here, we have live courses every day this week, I believe, but Sunday, so tomorrow night is a course I'm presenting on aerosol. We have Wednesday, another course, Thursday, Friday, as well as Saturday is our infection control course. That's 3 hours for 3 CE credits. And you can just go back to our website to register for those. This course will be available as a recording, and we'll send out a reminder. So if it's information you'd like to share with your practice, and I think you would, you'll have access to do so. All right, everyone, anybody need assistance before we log out? All right, well, I'd like to thank you all for being here this evening, and please check in with us for future dates. Have a terrific evening. Thank you.